Yeah, this is indeed one of the most important topics that we could be having, and not one that I actually would prefer that we have, because it is incited by some aggression by the state into one industry. I mean, the notion of picking an industry and saying it's costing too much, let's force less pricing, lower pricing. Let's start at 20% and negotiate down to 18% and make that the mandate. Everyone's going to reduce by 18%. If that's our role, if that's our proper role, why would we stop with healthcare? Housing sure is expensive. How about we mandate 18% less on all housing starting forward, and let's mandate that by law. Automobiles. How about food? Everything that we buy, if that is our role as a state government, let's start mandating lower prices, and let's pick something like 18% and force them all to offer that 18% less program, if that is our role. Well, I'd contend that it is an unnatural role. Why is it that pricing is as high as it is in healthcare? And healthcare certainly is a costly venture for all of us. It's costly because it is hard. It's costly because we expect perfection out of doctors, perfection out of hospitals. We come to them with a body that's not working right, ask them to figure that out, to diagnose us without being able to plug in an Ethernet port and do an electronic diagnosis. They've got to, by intuition and training and all kinds of equipment, try to figure out what is the basic cause of whatever our ailment, and then come to a solution that would do us a lot more good than harm. It is complex. That is why it takes many years in training for someone to become an RN, for someone to become a doctor. And then there are specialty areas that they need to be trained in, because this is complex. I remember hearing from students that visited, medical students that visited here in the Capitol a year ago, and one told me that his student loan was already in excess of $500,000. So they take on that risk of completing their degree and getting into the business and then being able to start paying that down, because it takes that level of preparation to provide those levels of service that we demand from them as consumers. It's expensive for a lot of reasons, but one of the biggest reasons is because of us, especially us, government at the federal level. This has got to be, and I don't know this by stats, but it's just got to be one of the most regulated industries in the nation. When you add more and more and more and more regulation and pile on top of that all of the lawsuits for malpractice when a doctor makes an incorrect judgment, the pricing goes way, way high. And what do we do with House Bill 1232? We add more regulation. Well, we've seen the promises a lot when government attempts to get involved in this most intimate service that we ask for, that we pay for, and we receive the promises of, if you like your doctor, you can keep your doctor. If you like your health care plan, you can keep your health care plan. And we all know that turned out to be incredibly untrue. I don't know if it was deliberately untrue, but it was absolutely untrue. And as my colleague, Representative Bockenfeld, said a moment ago, he got one of those letters. Hundreds of thousands of Coloradans got those letters that told them, hey, your health care plan that you like, you cannot have anymore because it's no longer sufficient to meet the regulation that we've just implemented, whether you liked it or not. Well, where we're at as a state is we are receiving incredible care from our hospitals and from our doctors. It's really good. We actually are something of a hub for the states that are around us. The residents who live in states around Colorado come to Colorado for care. What's likely to happen, oh, and by the way, there is a stat that you can go look up that shows that Colorado is the 6th lowest in national premiums. So no wonder we get this incredible care with the 6th lowest in premiums in the nation, and folks come here for care. So start picturing, though, if 1232 gets implemented, how many hospitals are going to start getting put up just north of the border into Wyoming? It's going to look like driving into Nevada with all the casinos just across the state line, because folks are going to move out of this state to avoid this level of regulation that's going to make it unprofitable and difficult to stay in business. I'm going to conclude with a shocking statement I've heard from one of the largest providers of insurance and healthcare in the state, a nationwide organization, Kaiser Permanente. So understand this, that Kaiser, at the initial writing of this bill, when 1232 was initially written, they said, we would simply not be able to operate in the state of Colorado. Okay, it's been rewritten quite a bit, strike below, but here's the quote that I have. So please, everyone listening who uses Kaiser Permanente for your health care, they said in order to meet the 18% requirement, as a quote, we would have to eliminate hospital coverage. Kaiser Permanente would have to eliminate hospital coverage in order to meet the requirements of House Bill 1232. This is not a smart move for us to be voting yes on this bill. Is it a smart move for us to pursue lowering healthcare costs in Colorado? Of course it is, and that's an agreement we can all start with, but we should not be moving down the government-regulated, government-enforced, nationalized system that this presents. So I'm going to urge you all to start thinking very negatively on your votes coming towards how we wrap up the conversation on this bill. Thank you, Mr. Chairman.